Good afternoon and welcome everyone to today's update from Northwood. Today I'm your moderator, Tara Wickwire, and as always, I'm joined by CEO of Northwood, Janet Sim, and Josie Ryan, who's the Executive Director of Long-Term Care at Northwood. So we will hear some upfront remarks and an update from Janet. And from there, we will go to questions and answers. And of course, to ask a question, please just put your name and your publication in the Q&A box, and I will ask those questions on your behalf. So with that, I will hand it over to Janet.
Thank you, Tara. Good afternoon, everyone, and thank you for joining us today. My name is Janet Sim, and I'm the CEO of Northwood. As we emerge from our complete focus on the care of our residents, we begin to digest what is happening in the world around us. I want to first acknowledge the important conversations and actions that are happening in society about racism, diversity, and inclusion in our communities. At Northwood, we appreciate the significant contribution of our African Nova Scotian colleagues and other equity-seeking persons, and acknowledge that there is still work to be done to ensure we are celebrating diversity and providing an inclusive and respectful environment for everyone. As our community begins to recover from the COVID-19 outbreak, Northwood remains committed to the continuing conversations and actions so that we can do everything to achieve and celebrate inclusiveness, equity, and diversity. Social justice and diversity are important to us, and we will continue to find opportunities to live these values at Northwood. We join you today on our road to recovery. We have no active COVID-19 cases in our Halifax buildings. This includes residents, staff, and our tenant population. The hope in the air in Halifax is palpable. And of course, we continue to celebrate the fact that our Bedford facility remains COVID-19 free. As we transition out of an active outbreak, we need to be diligent and ever vigilant in our processes to ensure that safety of our community is at the forefront. We have over 200 residents who have never tested positive for COVID-19, so we continue to be very vigilant. As our staffing levels have stabilized and we continue to have no active cases, we are actively planning for a time when we can bring back services like our hair salon and volunteer programs. The timing of these services will be determined by public health. We look forward to the day when our little village is buzzing again with activity, with residents, tenants and families, and our communities, of course, coming back and interacting on our main street, all physically distanced in accordance with the guidelines. We still have a few board staff as part of our team, but this will continue to decline over the next couple of weeks. We're so appreciative of the support that we've received and will cherish the friendships that we have made. Connections that will continue to long after the pandemic has passed. The support that we have received through the healthcare system should be something that we're all very, very proud of and very uniquely Nova Scotia. We're also pleased to welcome back our staff who have recovered from COVID-19. I really enjoyed seeing the joy in our residents' faces and eyes as they saw the familiar and friendly faces. And speaking of welcoming people back, those individuals who are staying at our recovery unit at a local hotel have begun to return and are scheduled gradually to return over the next couple of weeks until the end of June. We are continuing our efforts to provide residents with private rooms in the 2 Halifax campus buildings where long-term care residents live. Originally, when we started all of this, we had 270 private rooms and 108 shared rooms in these 2 buildings. In some cases, however, our residents have asked to remain with a loved one or friend, so we're considering and respecting the wishes of our residents whenever possible. We will always maintain some of our semi-private rooms to accommodate couples and those people who want to have a roommate. Currently, we do not have enough vacancies to create all private rooms, however. We have been working with residents and families in our resettling plan. As vacancies occur, we will continue to create private rooms. We are in active discussions with the Department of Health and Wellness regarding our future planning for our Halifax campus buildings. As we progress into our recovery phase, we're so pleased that residents have been able to have outdoor visits on our decks in courtyards in Halifax and Bedford. These visits will continue to be supported by staff, and we look forward to having the family visits as a new attribute in our recovery plan. We're so thankful that the nice weather is here to support those plans. Residents have also been enjoying the non-perishable packages that families have delivered over the last couple of weeks, and we're so pleased to now offer those opportunity for those drop-offs to be 7 days a week. And of course, we know how eager everyone is to see their loved one as soon as possible. However, we must do this in a very safely orchestrated plan and following the guidelines set out for us by public health. At Northwood, we know how important it is to stay connected with your loved ones, and our residents are so looking forward to Monday. We have been waiting for this announcement so we could activate our plan. We are thrilled to be able to offer family and friends visiting scheduled through outdoor visits starting on June 15th. Families will receive written information outlining the detailed outdoor visitation processes, along with reminders of proper social distancing and use of a mask when visiting. We're asking that everyone please be patient as we will be communicating directly with the families and substitute decision makers via email or phone. Generally, the details of our visiting will include 2 visitors are allowed per resident at a time for up to 30 minutes in the courtyard. There will be a maximum of 3 residents and their families permitted at a time, with marked spaces to ensure proper physical distancing. We expect to have 8 family visits the first day and increasing those visits over time. Visits will be scheduled 7 days per week. There will be strict guidelines in place to ensure the safety of our residents, their families, and the general community. Visits must be scheduled in advance. There will be no drop-ins permitted. To practice physical distancing, visitors must wait in their car until close to their scheduled visiting time. Visitors will be met by a screener who will ask a series of questions about their current well-being. Visitors' temperatures will be taken. They will be asked to use hand sanitizer and clean their phones. A staff member will ensure masks are appropriately placed, and then visitors will be accompanied to the visitation area. As difficult as this might be, there will be no touching permitted as the public health guidelines, and making sure that everybody is safe. Before leaving Northwood, visitors will be asked to disinfect their hands. We appreciate the support and understanding of those who are visiting with their loved ones. As you can see, there are a lot of safety measures in place to ensure the continued health and well-being of our residents. We are working very hard to ensure that we can offer these visits as safely and as soon as possible. I also want to reassure our families that these visits will be supported by our non-clinical staff. Your loved ones will continue to receive the high quality of care they expect and deserve from Northwood on their units. It is important that we're all following the public health guidelines to keep everyone safe. As we begin our recovery, we will not forget. We know how important it is to have an opportunity to grieve and mourn friends and family that have died during the pandemic. We're currently working with a donor on a floral display and a memorial that will be located in our courtyard. During our recovery, we will continue to test residents and staff who have tested negative for COVID-19 on a weekly basis until the facility is declared clear by the medical officer of health. We'll continue with screening at all entries. Universal masking and added precautions will continue until there is no risk to residents and in accordance with the public health orders and Northwood's infection control protocols. We must all stay safe and use our face masks, follow physical distancing, look for symptoms, and get tested regularly. We continue to be cautious as COVID-19 is still circulating in the community, and we must do everything we can do to provide a safe place for our residents to live with dignity. Thank you, and Josie, Ryan, and myself are now open to questions.
Great, thank you, Janet. Okay, so the first question we have from Stuart Peddle, the Chronicle Herald. What has Northwood learned about the outbreak in the facility, and what measures are being taken in the future to improve safety for residents and staff?
A lot of lessons learned, and we've invited experts in continuously to look at our practices and processes, so we continue to learn throughout. Certainly the discussion around private rooms and the dialogue with government is a key feature of what we'll be looking at moving forward, and Josie Ryan could probably add to that.
Yeah, I think the biggest learnings for us in the initial phases were around the virus itself, just around the symptoms, the incubation period, et cetera, and how to work through that and keep residents safe. That was, for us, it helped with practices, et cetera, and changing cohorting residents and cohorting staff, et cetera. So just knowing that the things that came forward with the virus. Initially, when we were screening for a cough, sore throat, cough, fever, and shortness of breath. And now if you look at the list of symptoms that comes with this virus, a lot of those symptoms we were experiencing. So I think we've also educated the system itself around symptoms, et cetera. And that was some of the early lessons learned that really helped us kind of get the virus under control.
Great. Okay. Now I'm going to a question, a few from Jennifer Henderson at the Halifax Examiner. So her first question, now that COVID is gone, does Northwood support calls for an inquiry into how the pandemic was handled?
As we've mentioned, we do have and continuously have had experts come in and we've consulted. So we're very transparent. We want to learn from this. We will be initiating those kind of learnings ourselves, and we'll respond and participate in any type of opportunity for the not only Northwood, but the entire long-term care sector, as well as the health system learning on this in this pandemic.
And another question from Jennifer. So what is your current occupancy number of long-term residents?
I can take that. Our current occupancy right now, we have 91 vacancies, so 180, I have to do the math, 485 minus 91 vacancies. That's what our occupancy is right now. And that includes the people that are at the recovery unit.
Okay, 394 looks like. Okay, I had to do the long math on that. So how are you, this is also from Jennifer, how are you preparing to protect staff and residents against a second wave?
I guess like we talked about a few minutes ago, we know so much more now. We've also been able to create more private rooms. We've been able to decrease the size of the units. Also education, so we are focusing on all the lessons learned as far as infection control. We'll be doing infection control education all summer, all along. Our screening will continue. Anything that we've learned, but a lot of our practices that were in place will continue into the second wave. Now that we have universal masking, that will make a difference too, because if there's people coming in, that does protect residents against spread too. So there are some practices that are in place that will help protect the second wave.
And another one from Jennifer, describe your current proposal being considered by the Department of Health.
So we have in the past number of years had a number of proposals, but we're certainly tweaking those proposals to ensure they reflect our learnings from COVID-19. So we do have a number of options and different conversations that we're having with Department of Health at this point in time.
Okay. And we did talk about this, but so she's asking, will Northwood be able to allow outdoor visits between residents and family members next week? That's a yes. She's wondering where that would happen.
We have two areas. Oh, sorry, Jen, go ahead.
You go ahead, Josie.
We do have two areas. We have an outside deck that will accommodate a number of residents, and we have a beautiful courtyard that residents, and there's actually external access to that, so the families can come in through the courtyard. So we do have two places that residents can come and have family visits.
Great, okay. And just the last question from Jennifer, are you now requiring staff to work only at Northwood, no other long-term care facility?
Yes, we've done that since the beginning.
Okay. Question from Alicia Drous at Global. Will there be any opportunity to have indoor visits, given that Halifax is often rainy or chilly? The availability of outdoor visits times will be limited. So she went indoor.
That would be up to the medical officer of health. Right now, we're following the orders and following their guidelines, which is outside visits at this time.
Okay. And a second one from Alicia. If we see a second wave in the fall, how will residents be better separated if there will still be shared rooms?
So right now we're down to about 30 rooms that are shared. Like Janet had said, we will keep a couple of, probably about 12 private or semi-privates, because we do have couples that want to be together, and we have a couple of roommates that do not want to be separated. We're hopeful that by the fall we'll have all private rooms and a decreased size of the units. So residents should be, almost all will have their own private rooms. We're up to about 130 or 330 people that are in private rooms right now.
Okay, I'll just put a last call out for questions if we had any others. But I think that covers it. There was a lot of information shared up front, so probably answered a lot of questions that people had. So thank you both for the time today, and thank you everyone for joining us. We will continue to post updates on the Northwood website, nwood.ns.ca, and you'll see very clearly the COVID information section. But thank you, and we'll continue to share information, but wishing everyone to take care and stay safe.
Thank you.
Thank you.